Hi, I'm Doug Jones and welcome to my video on finding a practitioner for the side effects from anesthesia. There are two main challenges that you're going to face finding a practitioner. The first challenge is to find a practitioner with both training and experience in treating the side effects from anesthesia. The second challenge is to find one practitioner with a wide enough range of skill sets to handle all the aspects of a course of treatment. Let's look at the first challenge, finding a practitioner with both training and experience in treating these side effects. To start out, you're going to need to ask about treating the side effects. And my recommendation is that you specifically use these words. I went into a surgery and had anesthesia, and when I came out, I had side effects from the anesthesia. Can you treat me for the side effects from anesthesia? There are two other terms that are sometimes used for these conditions. In my original training, I heard it as anesthesia shock affect. So you can ask if the practitioner can treat that. From the emotional or body-centered psychotherapy world, they'll talk about a trauma response to anesthesia or a trauma loop generated by anesthesia. It may also help to specify which kind of anesthesia that you received. Did you receive general anesthesia? Did you receive what they call regional anesthesia, which is one leg or one arm? Did you receive an epidural where they inject the anesthetic directly into the spinal canal? Did you receive local anesthesia? This matters, and it may change the treatment modalities, the treatment protocols for a highly skilled practitioner. Who has been trained in treating the side effects from anesthesia? Unfortunately, there are very few people out there with this training. So here are three groups that may have the training. The first group are craniosacral therapists. Now, not all craniosacral trainings are the same. So you'd like somebody with at least a 2-year training under their belt, somewhere between 700 and 1,000 hours of training. A second group are body-centered psychotherapists. One group that does cover this in some of their advanced coursework is a type of body-centered psychotherapy called somatic experiencing. A final group are practitioners who do traditional cranial osteopathy. Now, not all practitioners who do traditional cranial osteopathy are trained in treating the side effects from anesthesia, but some are. So you can find a practitioner from one of those three groups and ask them about their training and experience. Two more questions that are important. One is, how long have they been in practice? Because experience really does matter when treating the side effects from anesthesia. The second question is, how many patients or clients have they treated for the side effects from anesthesia? Again, experience really does matter with these conditions. Okay, let's move on to the second challenge, finding one practitioner with a wide enough range of skill sets. Well, let's look at the 3 skill sets that are required for treating these side effects. The first skill set is the practitioner needs techniques and modalities that can directly access and downregulate the central nervous system itself. The central nervous system being the brain, brainstem, and spinal cord. It's really important that the practitioner can directly connect with the central nervous system to help it calm, to help it reset, to help it settle. The second set of skills has to do with supporting you through the emotional and psychological upheaval that accompany the side effects or that are part of the side effects from anesthesia. Another way to look at this is to find a practitioner who can help you navigate the trauma response, the trauma loops that arise as side effects from anesthesia. The third skill set has to do with resetting or rebooting the body's energy system. It's virtually impossible to heal from these side effects or from anything else if you don't have enough energy to power the healing. Also, if your energy system is in chaos, if you're exhausted, depleted, really agitated and unsettled, it's very hard to have enough energy to heal. So you need to find a practitioner who has a modality that will treat the body's energy system and help it reset, help it find its order, help it reorganize. Unfortunately, it's very rare for one practitioner to have all three skill sets, but it's very important to ask them when you're interviewing practitioners if they can cover all three of these areas. One of the reasons that I decided to specialize in treating the side effects from anesthesia is I've been trained at great length in all three areas, so it's a good fit for me personally. Let's turn our attention to solutions to these two challenges. The first challenge: how do I find a practitioner with both training and experience in treating the side effects from anesthesia? For starters, you've got to understand that you will have to leave mainstream medicine behind. Doctors are invaluable, but they're not trained in treating these conditions. Pharmacists are out. There aren't any medications that can be given that will help you out of the situation you're in. Someone like a physical therapist is not trained to treat the side effects from anesthesia. You're going to have to leave the mainstream medical model and go into the world of the alternate care practitioner, the alternative care practitioner. These are the practitioners that will have the skills and the training necessary to help. Second, you need to plan on making a lot of phone calls and doing a lot of searches of directories for the keywords that I gave you earlier: craniosacral therapy, somatic experiencing, traditional cranial osteopathy. It's hard to find some of these organizations and their online directories, but it is possible. And once you find them in your area, you need to make a lot of calls to find someone who has both the training and the experience. If you can't make these calls, then recruit help from a loved one, a friend, a colleague, anybody who can help you sift and sort through the volume, because it will take some doing. Another approach that has worked for some people is what I call leapfrog. If you find an alternative care practitioner who is willing to listen to you and is willing to help, even if they don't have those three skill sets I talked about, it's a really good idea to ask them if they know a colleague, a complementary practitioner who might. And you kind of leap from lily pad to lily pad, from practitioner to practitioner, from a practitioner who will really listen and want to help to another practitioner who will really listen and want to help. And if you can keep going, you plug into their network. And it is possible to use their network by leapfrogging from one practitioner to the next with your questions to find somebody who can actually help you. Once you find somebody who says they've treated this condition, I recommend that you ask that practitioner, what are the symptoms of the patients or clients that you've treated for the side effects from anesthesia? See if the practitioner will give you a list of conditions: dizziness, memory loss, panic attacks, anxiety, depression, lethargy, exhaustion. See what the conditions are. And then what you do is you compare that list to your experience. And if your experience jives with the list of things that practitioner has treated, then this may be a really good fit for you. A final question that is really important to remember is, what kind of results did this practitioner get treating the side effects from anesthesia? Because the goal here is not to just get treated. The goal is to get treated and get better. The goal is to get treated and get your life back. That's the point of the treatment, and that's what we're all after here. Finally, let's look at some solutions for the second challenge, which is finding one practitioner with a range of skills. Really, there aren't that many out there with all three skill sets: the ability to interact with the central nervous system, the ability to support the trauma loop or help you through the emotional upheaval, and the ability to reset your body's energy system. So that's okay. There aren't very many of us out there, but you can do what I call mix and matching. So you may end up with 2 or even 3 practitioners. And you may have one practitioner who you go see when the memory just gets super fuzzy, when you have no short-term recall, when you feel like you're a complete foghead. You may go see the practitioner who addresses your central nervous system. When you have emotional upheaval and chaos, you may go see someone like a body-centered psychotherapist who can help you, who can support you through the emotional upheaval and get you out the other side. These practitioners will help you move through the trauma loop and out instead of having you stay stuck in the loop. You may go see another practitioner when you feel completely exhausted, that you have no vitality in your system, no energy, or if you have a lot of energy but it's all over the place, it's completely unorganized, completely chaotic. The ideal is that all of these practitioners would agree to talk amongst themselves to form a cohesive team of practitioners, a team that can support you and help you resolve and move through and clear the side effects from anesthesia so that you can get your life back. I know this option is more expensive and very time-consuming, but it can work, and you can get better by using this strategy of mix and match. One final note here, I do recommend that you exercise caution in skipping one of these 3. What can happen is that you can go some better and have a lot of setbacks, or you can get better and plateau. For most people who are suffering from the side effects from anesthesia, all 3 areas are in play: the central nervous system, the emotional system, and the physical or energetic system. And you do need to address all 3. As a last resort, or a final option, if you're not able to find one or more practitioners in your area, or if you've been getting treatments and you just haven't been getting results, here are 3 things that you can do. The first is consult with me directly. This consulting information is available on my website. You can buy a time slot with me, and very often I can make some recommendations, some suggestions, which can get you off of the plateau, or which can get the process moving forward again. The second option is a video on my website that's titled How to Help Yourself, What to Do and What Not to Do. If you buy this video, it'll give you 5 things that you can do that'll help you support and help yourself through this process. These 5 things don't necessarily replace treatment, but they really can help you manage yourself while your body heals. The final option is to come to Colorado and work with me directly. On my website, you'll see a Premier Package link. And the Premier Package is expensive and exclusive. There's a very limited number of them that I'm able to do. But if you come to Colorado and work with me with a Premier Package, you get a lot of my time and attention 7 days a week. It's very intensive, and I've had good results with it, helping people move through the side effects of anesthesia and come out the other end and actually get better. More than anything else, I want you to know that I wish you all the best. The side effects from anesthesia can be horrible. It can feel like you've lost your life and that you'll never get it back. And I want you to know there is hope and it is possible to get better. I wish you the very best of luck. Hang in there. Thank you.